Hello, I'm Dr. Professor Vijay Patil. I'm a medical oncologist. I at present work at Hinduja Hospital, Mahim and Khan. And before that, I was in Tata Memorial Hospital for 14 years. I was leading the unit of neuro-oncology, head and neck oncology, and thoracic oncology. Smoking is best that you don't smoke. But if you are smoking, it's best that you quit. So after, if you are smoking for 30 years, if you quit at 30 years, damage has been done, but still it's better than continuing smoking. The same way, if you have been smoking for 15 years, damage, some extent of damage has already been done, but quitting always helps. So quitting smoke helps with respect to decrease the chances of cancer, decrease the chances of cardiovascular events, and decrease the chances of other hematological damage which tobacco does. So one of the first effective strategy for combating tobacco addiction is that you need to have the willpower to stop smoking. It's very difficult to give up smoking. So first thing you need to decide that okay, this is harmful for me. The person needs to understand that it's harmful for him, and he needs to stop smoking. Unless you have this willpower which comes from the patient itself, it's very difficult to give up smoking. Many people feel that okay, smoke helps with their work, smoke helps with their normal daily activities. Then so it first has to be the inner insight. What we say that smoking is bad. That's the first thing we need to understand. Second is there are two things. One is why does person smoke again and again? Because they get addicted to nicotine. Today we have nicotine chewable gums. So anyone who wants to habit of smoking, you need to visit a psychologist or a psychiatrist. They would put you on nicotine gums. So with this nicotine, they will also teach you exercises. They will teach you lifestyle modifications. They will teach you trigger points which actually lead you to smoke. So you need to start the nicotine so that that urge doesn't come. You need to modify your lifespan so that you uh, arrange your daily activity that you don't feel the need for smoking and you need to avoid smoking. And it's always better that if you're giving up this habit to become a part of a group of people in which you would have some people who have given up smoking, some people who have started like you started giving up smoking. A discussion with them every 2 weekly or 3 weekly always helps. So also join a support group. So 4 to 5 prong attack, willpower, nicotine gums, lifestyle modification, trigger point avoidance, support group, support groups support. See, the priorities for any country are dependent upon the mortalities, not with respect to one situation, but overall situations. That's one. So, which is the one of the leading cause of deaths in. Second is if you detect it and if you put measures to circumvent it, how successful are the measures? I'll give an example. In our country, still infant mortality rate, which means children's dying within 1 month of uh, 1 year of their birth, or within 1 year, 1 month of their birth, or females having anemia, which is like simple things like iron deficiency, are and deaths because of diarrhea, deaths because of vomiting in children's, deaths because of are far higher than deaths because of lung cancer. Simple precautions like hygiene, screening for these patients for anemia, giving better nourishment to the children can not only prevent these deaths, but we can also build up the whole future. So these obviously, if you are in government, if I am in government, being a medical oncologist myself, if I am told okay, you put this much money and you can save the lives of so many children, which can build up the future of the country, you will always put the money first. We are at present unable to even do this thing properly. So I don't. There is no question here. What we can do is what is called opportunity screening, which means if you can afford, you can go and get yourself screened. But as a nation, it is difficult for India to implement the screening program for lung cancer because the risk to benefit ratio, the cost is very large. At the same time, the risk to benefit ratio in preventing children deaths is very large and the cost is very small. So obviously, you want to put give see, resources are limited. If you have huge resources, you can put everywhere, but when you have limited money, you will try to put it there. That's the reason why. So we can't expect India, unless it becomes a completely developed country where GDP increases, to start daily screening programs for things like lung cancer. I'll give an example: breast cancer, cervical cancer, much more common than lung cancer in this country in women. We don't have a screening program for them. Oral cavity, it doesn't require anything, it just requires torch and manpower to see whether you have oral cancer or not. We don't have a screening program for oral cavity. Lung cancer actually requires more technology. You need to do a low dose CT scan. So accessibility would be a problem. Even if you diagnose, then treatments are not done everywhere. You need to transport that patient to a, and the success rates are not that great. So overall, looking at this, I think what the government policies are correct, that they're putting more attention on maternal and child health at present, because our resources are limited. And I'm very sure when the resources are surplus, they would look at putting resources in other cancers also.
Rightly said, Dr. Patil. And you have been in the, you have so much experience in oncology. So, have you seen any notable changes in lung cancer outcomes over your experience
Yeah,
in these years?
yes. Lung cancer has changed, the situation has changed rapidly. I'll give you an example. In 1995, Canadian oncologists who used to treat lung cancer were asked if they themselves have lung cancer, how many would take chemotherapy? The answer was 5% said yes. The same question answer in 2016-17 was 95% yes. We have seen a dramatic change in the way the lung cancer is treated. Today, 6 or 70% of lung cancers have something what we call as driver mutation. When I was a student, driver mutations were just, well, this is in the first decade of this century, were just getting discovered. The lifespan of a patient of stage 4 lung cancer was less than 1 year, on an average 6 to 8 months. With these drugs, if you have mutation, if you receive appropriate drug, the average lifespan today are 5 years, 6 years, 7 years, 8 years, and we are raising the bar every year. So lung cancer. So can you imagine something from 6 to 8 months? We are talking now 6 to 8 years. So there's a huge, remarkable difference which has happened. The second thing is, if you are driver mutation negative, then you may have something called immunotherapy, which can be given in this situation. Again, the results are far ahead. 5 years and 30%, 40%. They are not as successful as the mutation, targeted mutation, but they are pretty successful. So today, chemotherapy, which was used to be given as a traditional, is limited to only less than 10% of the patients. So yes, with today's world, in 90% of the patients, the outcomes have changed. The problem is that most of these drugs are costly. So they're out of reach of many of our patients. So even though theoretically there's a possibility that things have changed, many of the patients cannot access that treatment. And here comes where, as a country, which is a low and middle income country, we need to do research here so that we can make treatments more affordable. We cannot expect West to make an affordable treatment for us. We need to make our treatments, and hence, because we make them, they will be more affordable. Like osimertinib is a drug which used to cost a lot. First line TKI used to cost less. So we did a randomized study of combining first line TKI with chemotherapy, and the results were as good as osimertinib. So the cost difference was actually 5 times less. The cost was same way. Drugs like immunotherapy. Recently, I did a randomized study in head and neck cancer. We are trying to replicate the results in lung cancer, where the cost for per year of treatment with immunotherapy was 65 lakhs. You could get that below 5 lakhs. So unless you do such kind of innovative research, these things are not going to happen. Just by saying that, okay, I'll do good service, I'll treat the patient, these things are not happen. And this is where I would request the uh, government. The government doesn't pay much attention to research, doesn't give much funding to researchers. This is a place where, unless in cancer, you give funding for research, you give uh, fund the investigators and enable them to do research, it's not going to, the situation is not going to change.